thank you for the opportunity of inviting Tower Hamlets Council and our partners up here to present our initiative in terms of smoking cessation and tobacco control. Can I first start by asking my team to introduce themselves, and I'm going to ask them to introduce themselves and say, the reasons why they're here today. So if I can start with Shaiman at the end.
I'm Shaiman Banerjee. I'm Associate Director in Public Health, NHS Tower Hamlets, and one of my roles has been strategic development and overview of the tobacco control strategy.
Good afternoon. My name is Ray Croucher. I'm a professor at Queen Mary University of London. I provide academic input into the development of the strategy, and I also manage one of the community-based programs that constitutes part of the strategy.
Hi, my name's Jill Goddard. I'm a senior strategist in public health at NHS Tower Hamlets. My responsibility for the last 2 years has been leading the development of the tobacco programme, which includes the smoking cessation services, and working very closely with our partners and stakeholders.
Okay. And I'm Colin Perrins. At Tower Hamlets, I'm the Head of Trading Standards and Environment Health Commercial, and I'm the current Chair of the Tobacco Control Alliance.
My name's David Tolley. I'm the Environmental Health Commercial Services Manager at Tower Hamlets Council. I manage the smoke-free team and work with the PCT to develop the smoke-free work plan.
My name is Chris Okworu. I'm a local community pharmacist in Tower Hamlets. I'm one of the recipients of the pharmacy. Let's start again. My name is Chris Okworu, a community pharmacist in Tower Hamlets, and one of the recipients of the Smoke-Free Business Award, and a smoking cessation advisor as well. Thank you.
Can also pass a message on from the Joint Director of Public Health in Tower Hamlets. He's a joint appointee. It's Ian Basnett. He's a wheelchair user, and unfortunately, because of the current sort of weather and difficulties, he couldn't actually sort of make it today. But we're here obviously with his full support, but he wants to send his apologies for not being able to make it today. Okay, he definitely would have liked to. Okay, so if we start the presentation part. Okay, in terms of the spirit of true participation, we're going to do this between the health authority and the local authority. I'll be doing the first part, and Jill will be doing the second part. Okay. Well, first of all, what I want to do is actually set the scene for the tobacco control strategy in Tower Hamlets and where it comes from. Now, in terms of Tower Hamlets, it's the third most deprived borough in the country, and with that deprivation, in general, means poorer health and poorer and lower life expectancy. Added to that, smoking is a big issue in Tower Hamlets because it's got a very sort of high prevalence rate. Over 16s, 37% of over 16s actually smoke in Tower Hamlets, and the national average is 21. And what that means is that mortality from smoking is much higher than it is than the national average, and it means that as far as smoking is concerned, it's the single biggest killer in terms of the population, and at least one person a day dies because of a smoking-related illness within the borough. So that is the context. In terms of the response to that context, there was really sort of two drivers for change that happened. The first was the appointment of Ian Basnett, who was appointed as a joint director for public health, and that means that he is jointly appointed by the council and by the local National Health Service. And also the other driver was the introduction of the smoke-free legislation in 2007. When Ian came, he knew that smoking was right up there in terms of an issue that needed to be addressed, and he actually suggested that there was a need to actually sort of agree a joint policy to reduce smoking prevalence within the borough. And so what happened was that we set up a broad-based multi-agency alliance, and it was formed to actually sort of produce a tobacco control strategy that was holistically going to address all the issues around smoking and the use of tobacco. And so what we did, we actually sort of formed a group that consisted of a diverse range of interested organisations. That's from public sector, voluntary sector, and from the private sector as well. And in terms of the whole process, it's actually sort of been driven through the borough's local strategic partnership, and it's actually sort of reflected in the borough's local area agreement. So it is right up there in terms of a priority within the council. The strategy was developed through an extensive process. We held workshops with the use of external facilitators, and we consulted with key partners with expertise and networks, and we also engaged with local residents to help develop and hopefully have the sort of continued success of the alliance. The product that we produced, I think, actually sort of demonstrated a keen interest and commitment to work from all of the partners. There was a lot of thinking outside the box in terms of how can we actually sort of produce a strategy that really is going to sort of produce and is going to fulfil what its objectives are. And what that did, I think, was that it actually sort of produced commitment across the board in terms of actually sort of delivering on the objectives. Also, what there has been is elected member priority, and that was reflected in the early stages of the strategy, when we actually sort of went through a comprehensive overview and scrutiny process, and out of that process came a lot of useful comments and an action plan that actually sort of helped the development of the strategy. And performance and progress have been robustly monitored throughout all levels of the programme. So that's at a high strategic level, right through down to a team and a service level, to make sure that all the activity is actually sort of being conducted. In terms of the strategy, it's in essence really sort of quite a simple strategy. What we're doing is basically saying that Tower Hamlets is going to be a place where it's hard for people to start smoking. And the elements of that revolve around regulation, they revolve around education, and it's trying to actually sort of make people put themselves in a position where they don't want to start smoking. So there's a work stream that relates to that. There's also a work stream which is around easy to stop, and that's all around having a comprehensive smoking cessation program in place. And so the health authority is basically sort of responsible for that, and what they've got is what we think is an innovative and a comprehensive program, which actually sort of means that if people want to give up smoking, then they can do. And the issue there about smoke-free environments, that's all around second-hand smoke and making sure that in Tower Hamlets, people aren't subjected where there isn't a need for them to be subjected to the problems and the issues around second-hand smoke. All of it's bound together with a comprehensive marketing and communications plan. And what we think we've done is actually sort of, again, use innovation and creativity to have a lot of initiatives which has helped promote and sell the strategy. And the last issue that we've actually come up with is a research and evaluation program, and that is all around making sure that we combine with the academics in the borough and make sure that everything about the strategy is being assessed, and if there are opportunities for us to evaluate and assess what is happening, we can use that as a learning process to further develop the strategy.